city was Kisii. Your Excellency, I'm sure you know the distance between Narok and Kisii. So we need really, and I'm happy that the county government is well represented. We need to stake this so that we have every county has 2 or 3 centers supporting this patient. Your Excellency, thank you very much for your support. I want to welcome you to Nairobi Hospice. Our gates are usually open, so when you are free, feel free to come in. We'll be able to interact. For those who want to learn, we also are training institution. We train on palliative care, both short courses, and also we have partnered with Oxford Brooks to train on how deployment palliative care. Thank you very much. Your Excellency, if you allow me, I would invite David to give his remarks. Thank you, Your Excellency.
Your Excellency, wageni wote wamekuja siku ya leo. Your Excellency na Margaret Kenyatta na wageni wote wamekuja siku ya leo kuwatembelea. Kwa majina naitwa Deputy kutoka Siaya County. Mimi gonjwa serikali ilianza last year October 5. Sikuwa naona, sikuwa natembea, sikuwa naongea. Vile nilifika hapa hata ni Mungu. Sasa narudishia asante sana. Saa hii narudishia watu wa Hospices kule walisaidia. Mpaka saa hii naweza ongea, naweza tembea, hata naweza fika hapa siku ya leo. Narudishia asante sana. Kwa machache bado kuongea ni shida. Hata kutembea saa hii Mungu amefanya milima mpaka nafika siku ya leo hapa. Narudishia nyinyi asante wageni wote mpaka hii Nairobi Hospice kusimama na mimi. Tena naomba wale wote wamefika hapa siku ya leo. Leo ugonjwa ni mbaya, leo ugonjwa ni mbaya sana. Hata sijaamini. Tayari Bajola ilikuwa amesakata kwa ule leo mambo ya dunia nimeachana nayo. Kile Mungu amenifanyia miujiza mpaka nikafika bado narudishia Mungu asante na hii Nairobi Hospice. Sina mengi, kwa sababu kuongea bado ni shida. Hata sioni mzuri. Bado na niko kwa chemotherapy. Kile ni Mungu. Kwa haya machache baada nikudusia asante kwa kuja siku ya leo. Wenyewe hata utuane nikaribishwa, hata mimi nisema asante. Mbarikiwe sana, mbarikiwe sana kabisa. Asante.
Asante sana kwa ushuhuda huo mzee wetu ambaye ameshuhudia ya kwamba amepata mabadiliko makubwa sana tangu alipokuja hapa. We want to thank you for that testimony. That is one of the beneficiaries and the patient of this institution who is on recovery. Thank you for that moving testimony. Your Excellency, it is now again my duty to invite the chairperson of Non-Communicable Diseases Alliance Kenya, Dr. Zipora Ali, to come and make brief remarks.
Thank you very much. Your Excellency Margaret Kenyatta, First Lady of the Republic of Kenya, Honorable Caroline Karagu, who is the Deputy Governor of Nyeri, but also the Goodwill Ambassador for Palliative Care in Kenya, Governor's Hospital, Vice Chair of the Health Committee, Dr. Andrew Mulwa, Acting Director of Medical Services, Dr. Juliet Nyabwanga, who I met this morning representing WHO, Dr. Garold Macharia, CHAI Vice President, Dr. Frederick Bukachi, the Chairperson of the Nairobi Hospice, and everybody who is here today, because you are all truly, truly distinguished guests. But more importantly, to David and many other people who are living with palliative care needs. I'm so glad that we are meeting you today here, and I'm so glad that you're actually here to open the hospice and to launch our policy. It has been a long journey. that started in 2007. I worked at the first Nairobi Hospice for 15 years as a doctor under the leadership of Dr. Bridget Serengo, the pioneers of palliative care in this country actually. And I'm speaking from experience that I observed, took care of these patients for 15 years and their families. They live in pain and suffering, Your Excellency. They live in pain and suffering, and as Dr. Asaf has said, it can be so exhilarating that the patient screams. As you're going to visit the patient at home, you hear the screams from the gate. So we really hope that this policy is going to change this. And so I have written a speech because I tend to forget. I'm old, I'm not like Asaf, so I forget my words. So maybe I'll just go through my speech because I will talk for a long time. I love to talk. I'm a palliative care doctor, so you talk a lot with your patients, but I'm also a teacher, so I'm also hopefully one day become a politician and talk too much. But anyway, thank you so much for coming to this event. Like I said, it has been a very, very long journey. It started very many years ago, and I always remembered a poem I read when I was a very small kid by somebody called Hugh Langston or something like that. He said that hold fast onto dreams, for if dreams fly, life is like a winged bird, a broken winged bird that cannot fly. We held fast onto this dream for many years of seeing a hospice materialize here, of seeing a palliative care policy materialize. And this is happening today, so we are really, really very grateful. And I stand here on behalf of civil societies, patient-led organizations, and most importantly for people living with palliative care needs and people living with non-communicable diseases, and many other people who have got serious health-related illnesses, because palliative care is not just for cancer patients. It cuts across any serious illness, whether it's HIV, TB, and any other illness. Children with congenital diseases also receive palliative care. So it focuses on improving the quality of life of those with a serious health-related condition using a holistic approach. Our approach focuses on the whole patient, not on a disease. We look at their physical needs, their pain, other symptoms. We look at their psychosocial needs, their spiritual needs, and even their financial needs. Most patients, by the time they come here, have sold everything, their last chicken, to be able to get maybe morphine or to access palliative care. So the pain is real. So it is our desire and belief that this policy will ensure access to quality palliative care for all in need in our country. That is our motto, access to quality palliative care for everybody in Kenya. Leaving no one behind, as you can see on our posters. This is our theme for this week, that we do not want to leave anyone behind. Equity in access to palliative care for everybody who needs it, so that nobody will die or live in pain and suffering. Therefore, we should ensure that palliative care is well embedded in our healthcare system. It is included in the USC package and is covered by NHI and other private insurance sectors. So, like I said, having worked as a doctor for 15 years at the hospice and also having been the executive director for the association, Kenya Hospice and Palliative Care Association for 15 years, it is, you actually see a lot of things when you go out there into the field. We travel this country, Dr. Asaf, our team, we travel this country to Garissa, to Kahuma, to Dadaab. We saw a lot of suffering. And so we really need to address these issues, because these are Kenyans. They have a right to health like me, like you, like everybody else. They must access quality health care. So the unmet needs of patients is very important. I hope this policy will address those unmet needs. The pain is real. Yesterday I was in a webinar, and the WHO director, Dr. Tedros, actually told us that he has sent a letter to all states of governments, of countries, all the states, member states of WHO, for the leaders of the states, to ask them to integrate palliative care in all levels of healthcare, ensure training and education of healthcare professionals as well as community health volunteers, ensure access to essential medicines. We use a lot of strong medications for pain, especially cancer pain. We use drugs like morphine, which sometimes we run out of stock. But I'm happy to say the government has been very supportive through the National Cancer Control Program and has been actually providing the morphine for the past 5 years. So we need to assure they have access to essential medicines, commodities, and policies that support palliative care, including financing. And that's where the challenge comes. We don't have finances for palliative care in this country. These hospices have to struggle to get money. They are not supported financially. So it is our duty as Kenyans to ensure that palliative care is well integrated into our healthcare systems. And I want to acknowledge our government, like I said earlier on, for the great work they have been doing under the leadership of your sweetheart, President Uhuru. So please pass the message from the Director General to him that he should read that letter and respond accordingly. Thank you. So I want also to recognize the people who have been really behind this policy as well. The Kenya Hospice and Palliative Care Association team, Dr. Weru, the chair, is not here today. He sent apologies, but I can see Mrs. Wari is in the audience, and other members of the board who have really been supporting the association, and the leadership of the association as well. I know Maculin is here. The team at the hospice, at the KEPCA, have really worked hard with the Ministry of Health with Dr. Nyangasi and WHO, Dr. Nato, to make sure this policy is actually developed and is going to be launched today. So thank you very much to the KEPCA team for your technical support and everything you've done towards this policy. But I also want to recognize hospices and palliative care providers. These are the people who are so important. They are the ones who provide these services, and especially the nurses. 90% of palliative care in this country is provided by nurses. They're the ones who spend time with these patients. They're the ones they're the ones who have the shoulder to lend to the patient to cry on. So I know there are many nurses here. I saw Lydia from Nyeri. I saw Muriel from Taita Taveta. I saw Mwangi from Kenyatta. There are a number of nurses I've worked with here. They are champions who are doing this. I want to appreciate them, the service providers, the hospice and palliative care providers, and the community health volunteers who also take care of these patients in the communities. And of course, the families, who are very important because they take care of these patients on a day-to-day basis. They need our support. And so it's very important that we support all these teams as well. So our request, again, like Dr. Asaf has given many requests, I'll add some more also, is that in collaboration with all of us, as the relevant stakeholders, that the implementation of this policy should actually be actualized. We are there to help, to support, whether we might not be able to support financially, but we're able to give our technical support to ensure that this policy is disseminated and is also implemented, and that nobody should die in pain and suffering. So I'm actually, I'm standing here not just on the behalf of NCD Alliance, Non-Communicable Disease Alliance, but for all people who work in this space of health, that we actually will support this initiative as much as we can. So I want to congratulate Nairobi Hospice. Like I said, I worked in the hospice, the first building. It was a wooden building with Bridget for 15 years. This has been a big dream and it has come true. I want to congratulate Asaf. Mrs. Wera, you are involved, the chair, Bukati, and his team, and even those who are the pioneers, Dr. Zarvaji, from many years ago, who really put a lot of efforts into this new building. It has been a long journey, but it is here today. So thank you very much, Nairobi Hospice. Congratulations, Nairobi Hospice board team. Mrs. Anderson, you have been very, despite the fact you're even over 80, you still come to this function to actually, and so Mrs. Anderson, actually, I really admire you. You're my mother's age. You still come to such a function. Thank you very much. Bridget, the first nurse, palliative care nurse in this country, the one who mentored me. I was a doctor, she was a nurse, but I learned from her. So that's very important also. So thank you very much. And so, First Lady, I think we'll be giving you so many requests. We know that you love mothers and children. Our children suffer, our mothers suffer. So we hope that you will take back the message and that you'll be able to support this hospice. Kimbelia Hospice is an inpatient hospice, 24 patients. They are not covered by NHIF. Tigia Hospice has 13 patients. They're not covered by NHIF. The patients are not able to pay. So these guys have to get money from the UK, from somebody else, from the US, to support our own people. Why? We can actually support our own people. So I could stand here and talk for a long time, and all of us can give speeches. I want us to give us just 1.5 minutes to a video for you to see what Dr. Asaf talked about, how palliative care can improve the quality of life of patients. David, can you have the video? It's just a very short, because it's good to hear from the patients as well. Thank you very much. I will not be coming back.
Discharging pus and as an ointment to manage the pain and irritation.
Your Excellency, First Lady of the Republic of Kenya, Madam Margaret Kenyatta, Honorable CAS, Dr. Mercy Mwangagi, Governor Ojemong, Deputy Governor Harogo, WHO Representative Juliet, Dr. Mulwa, County Commissioner, Ministry of Health, National Cancer Control Program, Division of Non-Communicable Diseases, all protocols observed. Good morning. We're just about to touch afternoon. Good morning. I think having heard what has been spoken before by the people who stood here before me, all of us have a story to tell about cancer. 2 weeks ago, this Friday, I buried my uncle, Dr. James Magaria, who was suffering from, diagnosed in June with thyroid cancer, and by September he was gone because the cancer had spread to his spinal cord. So we all have a story to tell, and I'm not here to tell that story, but to commend Nairobi Hospice for the work that you've done over the years. I think I saw Bridget there. She made me play very many golf tournaments to raise money for this building. I'm not sure I played good golf, but I did raise some money for this building. And that was back then. So it's good to see the progress that has been made here. Now, the Clinton Health Access Initiative works in 40 countries around the world, and Kenya is one of them. We've been here 16 years now, and we have some work that we do with the National Cancer Control Program. And Dr. Mwangangi, I'll tell you, is a very energetic and hardworking team there at the National Cancer Control Program. It's a small team, but they really, really work hard, you know. And I'd like to commend them for the work that they do, because it is a lot of work. We've been working with them the last 2 years or so on cervical cancer, doing a lot of rounds around the counties, giving out equipment to manage cervical cancer, training a lot of healthcare workers to screen and treat for cervical cancer, and to ensure that cervical cancer, which is one of the cancers that you can actually prevent from becoming severe disease, doesn't get to this point where we need palliative care. Not that there's anything wrong with palliative care, but palliative care is hard work, you know, and this hospice here does more than anyone can imagine out there. There are probably requests that will keep coming. I won't make any requests of the First Lady, but I'll make 2 commitments, you know. And the first one I'll make is that the work that I had started doing with KEMSA to lower the cost of oncology medicines, I will continue doing that work and bring down the cost of oncology medicines and make chemotherapy much more accessible. Dr. Mary Nagasi, who's head of the NCCP, tells me there are 9 centers that are coming up, are in the process of coming up to manage cancer around the country. And I will make sure that I work with KEMSA to make as many oncology medicines available for access to those facilities at the lowest cost possible. The next commitment I will make here is that those 9 centers that are setting themselves up, the latest technology that is needed to manage whether it's invasive management of cancer or just normal management of cancer, we'll work with them to make sure that they have the latest technology that's available to manage those cancers that come their way. That's my second commitment. But lastly, is to commend you, First Lady, for your efforts, for your work around children. That has been applauded all over the world, not just in this country, and to urge you to continue doing that work even after you leave the office of the First Lady. Please do not forget to continue that work. Do not retire. Your husband says he's going to retire to be a farmer. I'd ask you to retire and continue the work that you've been doing for the country, and thank you very much.
Thank you, Daktari. Also, Your Excellency, allow me to invite Dr. Juliet Nyabionga, County Representative, the country representative of World Health Organization, to speak to us.
Am I that short? Your Excellency, the First Lady of the Republic of Kenya, and Honorable Mercy, the Governor and Deputy Governor here, senior dignitaries from the Minister of Health, the Government of Kenya, and partners here, allow me to observe all protocols. Ladies and gentlemen, it gives me great pleasure to be with you today as the country launches its first policy on palliative care. And I want to congratulate all of you. At a personal level, I'm passionate about palliative care and cancer control because my close family back home are involved in providing these services. Palliative care is a crucial part of integrated people-centered care and also a core component of universal health coverage. And we do note that it improves the quality of life of both patients, adults and children, and their families facing problems associated with life-threatening illness. And our global need for palliative care will continue to grow as we increase life expectancy, as we witness a rising burden of non-communicable disease. And we are all responsible for ensuring dignified lives of our population, irrespective of the condition and age. Relieving serious health-related suffering is a global ethical responsibility, and palliative care must be made available at all levels of care, including at household level, wherever needed. The World Health Organization estimates that only 14% of the 40 million people who require palliative care services do receive them. And as we all work towards universal health coverage, in order to achieve the Sustainable Development Goal 3 and the targets therein, palliative services must be strengthened, thus leaving no one behind. However, in achieving this, ladies and gentlemen, we need to overcome several barriers. The gaps in policies and strategies, and I'm pleased that today we are launching a policy that will guide our efforts in providing services and reaching the people who really need this care. So the basic packages we do provide, in many cases, do not include palliative care services. The limited skills of health professionals in providing palliative care services, gaps in our medicines and logistics systems, and I'm pleased to hear today that at least in Kenya, morphine is already in the essential medicines list. Other barriers to palliative care include the limited awareness and appreciation of the benefits it can offer to patients, cultural and social barriers, beliefs and misconceptions about death. This morning we had a chat with the Deputy Governor who mentioned that in her sensitization efforts, she has realized that people look at cancer as a curse. So these are the misconceptions we really need to overcome to improve access to services that improve the life of our people. So we need to strengthen the health system and include palliative care in the essential health care packages And also, we need to ensure that palliative care is funded as part of the financing systems. As we talk of allocation of health services, as we talk of financing the healthcare package, palliative care must be at the center of these discussions. The human resource development policies need to take into consideration the required capacities of our health workers at all levels of care, such that they're equipped to provide the services, as well as educating volunteers and the public. Ladies and gentlemen, the World Health Organization has included palliative care medicines, including those for pain relief, in the WHO essential medicines list. And again, the World Health Organization recognizes that palliative care is a key responsibility. And again, the colleague who talked here earlier, the Dr. Zipporah, said that the Director General has already requested member states to really pay attention to this service that has been a gap in many health systems. We have global mandates we've committed to universal health coverage. We've committed to mandates around people-centered care and integrated services. And I think as World Health Organization, we'll continue to support the country in implementing these commitments. But even more important today, as we launch the National Palliative Care Policy, we are fully committed to support you in ensuring its implementation. So, Excellency, ladies and gentlemen, let me take this opportunity once more to congratulate the government of Kenya for putting in place efforts and recognize the importance of palliative care services by developing and launching this important document, the National Palliative Care Policy. And as the World Health Organization, again, we are committed to support you. But I want to encourage all of us at our level, within our sphere of influence, to join hands and support the country to implement this policy document to the letter. Thank you so much.
Thank you, the representative of WHO
and Deputy Governor of Nyeri County, and also Goodwill Ambassador for Palliative Care, Dr. Caroline Karugu, my colleagues from the Ministry of Health, good afternoon once again. May I begin by greeting all of you again from the Nairobi Hospice. It is my pleasure to welcome all of you to our home, the Hospice. We've had a chance to tour the building, and I invite all of you who haven't had a chance to do that after the event. Nairobi Hospice is a charitable organization that was established just over 30 years ago, to be specific, to support patients and families with the conditions that are hard to cure. As mentioned before, patients with cancer, patients with HIV/AIDS, organ failure. We have children and young adults with sickle cell disease, among others. And we serve both adults and children within Nairobi and the neighboring counties. The hospice has applied a four-pronged outreach procedure in our services. The first is the outpatient service, which again is available here as a robust service. We do hospital visits. We also do home visits and community outreaches. Since the inception of the Nairobi Hospice, we have served over 50,000 patients and families to scale up access to palliative care services in the region. Nairobi Hospice has been training both health workers and non-health professionals on palliative care. And today we have trained over 5,000 individuals so far. We are happy that we've partnered with Oxford Brookes University in the UK to train multidisciplinary healthcare workers at higher diploma level in palliative care. And our students have been asking for this to be scaled up to degree level, and we're in discussions with local universities to be able to do that. Your Excellency, allow me to appreciate the support we have received from the government over the years, including donation of this land on which the hospice stands today. We need to clap for the government for that. The building that you have just opened this morning was an effort of several donors, some of them seated here, and we'll have a chance to appreciate them in the process. Now, in addition, the government has also extended tax exemption to the hospice, which is something very laudable, and also supply of essential medicines, including morphine, which is available within the hospice. As a charity, the organization, we believe that no one should live and die in pain, as that was mentioned earlier by our CEO. With the support from the government, partners and friends, the hospice, we have managed to serve the most vulnerable in our community and those neglected with limited resources that we have at the hospice. Our motto, as it stands, and over on the entrance of our building, is put life into their days, not just days into their life. And that attests to the work that we do every day as the hospice. May I say a few things about the challenges we have faced during this COVID-19 pandemic? It has affected our work significantly. In terms of service delivery, we have been forced to change approach in the way we do our work. The hospice team has engaged into modern technology to be able to deliver service to some of our patients or clients through telehealth, and it's something that we'll be building on with partners as we go into the future. We've also been forced to go beyond medical care to support our patients, especially through the NHIF program to cater for active treatment. And again, that is something that we hope will continue into the future to get more patients and clients on board. We're appealing to the Ministry of Health and the Metropolitan Services to consider additional secondment of staff to the hospice. This is a service that was there before and was discontinued. We would be very glad to have more hands, especially medical officers, the nurses who carry the burden of the work we do here, and social care workers. In addition, Your Excellency, our heroes are the nurses and the other staff who go out into the communities, both within the suburbs of Nairobi, into very difficult places to approach, and also the environs. One of the best challenges they have is the transportation to those sites, and we request your office and other well-wishers to be able to support the hospice in acquiring vehicles to be able to help our heroes perform their work to reach more people. We believe by doing so, this support will enable us to scale up our work and support more people. Our recent achievement is the construction of the new building, which we were honored to have you open this morning. This building has been an effort of many, many partners seated here. We began, as it was said earlier, as a small office right behind this wall in Kenyatta Hospital. We've been out in Kilimani in a rented building, and finally we raised the funds to be able to put up this building. We must clap for our supporters. This building you see in front of us has strengthened our service delivery. We now serve as a referral center. We have a small revenue generation from the activities we do here, which is plowed back to support our patients and clients. We intend in the near future, again with support from your office and other partners, to see whether we can be able to open additional services, especially patients who need daycare, like blood transfusions, intravenous infusions, pain care, and so on. It is something achievable. We now have the space. We need the resources to be able to provide that. Finally, I must sincerely thank all the board members and directors who you had the chance to meet this morning. These are men and women who donate their time for free. They're professionals from all walks of life. We have medical doctors, we have business people, engineers who donate their time to provide support and leadership to the hospice. May I again invite you to clap for our board members. We did not have a chance to thank them enough earlier. The hospice intends to continue to grow, and I'm sure with your support, Your Excellency, and other partners who are here, we will continue to grow in order to be able to support the community at large. And we are delighted and profoundly happy that the Minister of Health and yourself chose the Nairobi Hospice to launch this document that we're going to launch within the hour. Thank you very much, and karibuni sana to the Nairobi Hospice. It is my pleasure to invite Dr. Andrew Mulwa on behalf of the Acting Director General of the Ministry of Health. Dr. Mulwa.
Thank you very much, Chair. Your Excellency, the First Lady of the Republic of Kenya, Madam Margaret Kenyatta, the Chairperson of the Nairobi Hospice, His Excellency Governor Sospita Jamong, the Vice Chair of the Council of Governors, our leader in palliative care champion, Madam Caroline Karugu, our CS, Madam Dr. Masi Mwangangi, ladies and gentlemen, distinguished ladies and gentlemen, good afternoon. It's my pleasure to join you here to open the Nairobi Hospice building and as well launch the first ever palliative care policy in the Republic of Kenya. Indeed, the WHO World Health Assembly held in 2014, resolution number 69.17 urged all governments to prioritize palliative care in the public health services. And as a country, I can confirm we have been working with all the stakeholders to ensure that is done. It is estimated that 69% of adult persons who need palliative care have a form of non-communicable diseases, and amongst this, 28.2% are as a result of cancer, while HIV, cerebrovascular diseases, and dementia contribute 22%, 14%, and 12.2% respectively. COVID-19 emergence has also posed a new challenge of chronic illnesses resulting from COVID-19, and therefore growing the need for palliative care in the country. Worldwide, just a small majority of people, 1 in 10, are able to access palliative care. This causes great suffering amongst the people who badly require this care. The situation is the same here in this country, and only a handful of health facilities are offering palliative care. Dr. Asaf Kinyanjui mentioned only 75 in the whole Republic and in 25 counties, meaning there are 22 counties that palliative care is not available. Palliative care helps to relieve serious health suffering associated with chronic diseases, and when provided adequately, it eliminates the need for frequent hospitalization, therefore reducing unnecessary health expenditures. Many households in Kenya have felt the economic, emotional, and psychological impact of cancer and other non-communicable diseases. Frequent harambes is the norm, and many WhatsApp groups are being created every single day to facilitate cancer treatment for friends or relatives. The palliative care policy developed in line with the National Cancer Control Strategy 2017-2022 through a consultative process with a team of experts in palliative care, both locally and internationally. It went through rigorous validation process to refine its content and make it specific for our content. A minimum package of palliative care services proposed in the Lancet Commission on Palliative Care and Pain Relief that includes human resources, medicine, and equipment has been adopted in the policy and will be prioritized in the Ministry of Health in its implementation. The Ministry of Health has made great steps in improving cancer management. The waiting times at the referral hospitals has greatly reduced, with more trained specialists now locally available and more infrastructure established. Indeed, national referral facilities at Kenyatta National Hospital, Kenyatta University Teaching and Referral Hospital, Moi Teaching and Referral Hospital have been enhanced and
I thank you very much, Your Excellency, Mama Taifa. Our CAS, look at the ripple effect of 5 million Kenyans and the families that they affect, we would easily be looking at 20 million Kenyans. Your Excellency, today is a great day for us, especially for me as an ambassador for palliative care needs in this country, because we have made a great step by, number one, bringing the conversation to fore, a conversation that has not been had, and a conversation that has been looked at as a very technically complicated conversation. Let me start by really congratulating the team at the national government level for this wonderful policy. I wish to confirm to you, Your Excellency, that this policy is well researched. I have been in constant communication with Dr. Ali Zipora, and she has made sure that the policy is representative of the needs of the ground. And for that, I want to truly thank the national government. I want to thank you, Your Excellency, for even coming to the hospice. It is not easy to visit hospices. People call these places a place where there are the walking dead. I remember when I was appointed by KEPCA as the palliative care ambassador, they called me the ambassador of the walking dead. And I said, no, not everybody that goes to a hospice is bound to die. We go to hospices to extend the lives of these people and the quality of life. So thank you for that show of goodwill. We need goodwill from 5 institutions in this country. We need goodwill from the national government. Like I said, thank you for the policy. We need extra goodwill from the national government to ensure that this policy is then taken to the grassroots, it is embraced by the county governments, and that, I think, is a responsibility of the national government. We need goodwill as well from the county governments. We have 79 hospices scattered across the country. We have over 100 NGOs dealing with palliative care. And I would wish to ask Your Excellency Governor Ojamong, on behalf of the Council of Governors, we'd like you to embrace the palliative care centers and the hospices in your counties as part of your continuum of care. In Nyeri County, where I come from, we happen to be the leading county in non-communicable diseases, cancer, hypertension, and diabetes. And our Nyeri Hospice, we've been able to include our Nyeri Hospice in our continuum of care. We have been able to give them and supply them with pain medication and medication that cancer patients especially need from the hospice. We've also been able to second our nurses to the Nyeri Hospice, where they're able to then further serve. So I want to call upon the county governments across the country to replicate what is happening in Nyeri County as an initial step of goodwill. We need goodwill from the training institutions as well. One of the things that we are told, especially, and I feel very sad when our patients are told that, they're told we do not have staff who are well trained in palliative care. We're told we do not have staff who have gone to school and are specialized in this particular sector. I wish to call upon you, Your Excellency, to put in a good word to see if our institutions can make palliative care compulsory for every medic in this country, whether they're a nurse or a clinical officer. Let us train everybody on palliative care and eliminate these excuses. We also would need a little bit of goodwill from institutions of higher learning on research. Sometimes we are all groping in the dark. Why is Nyeri County ranked highest in, for instance, non-communicable diseases? Why is Nyeri County ranked first in prevalence of breast cancer, cervical cancer? We do not know what to tell these patients as county governments, and we want to call upon the institutions of higher learning to also put in some goodwill in this sector. Let us research so we're able to come up with interventions that are truly researched and helpful to Mwananchi. The fourth and last area we need goodwill is in the area of UHC. We're hearing there is the UHC program. As you roll out the UHC program, we want and we would like to request that palliative care patients become automatic members of the UHC program. We also want to request that NHIF gives us a little bit of goodwill, because what we are currently seeing in our hospitals is that especially cancer patients are being forced to pay 2-3 years in advance. So they're not requested to pay 6,000 shillings. They're actually requested to pay 21,000 shillings. This is extremely punitive to the people that I represent, and I would wish for a little bit of goodwill to come from NHIF so that some of these issues are addressed. Let the cancer patients and let the patients who are going through palliative care be also included. For instance, in the oncology package, let us include palliative care. The last thing is there's the issue of pain medication, colostobags, and I think the CEO alluded to that when he was giving you a tour. It is a real problem. There's a time in this country where we do not have any colostomy bags, and you can imagine what that does to the dignity of the patient. So we'd like to request that the government considers that pain medication, colostomy bags, and these interventions that are very useful for palliative care are made free and are also brought to the primary health care centers, because currently we are having to take our palliative care through matatus. Some of them are dying on top of border borders as we rush them to our level 4, level 5 hospitals. We would wish that these things are further taken down to the primary level healthcare centers where they are able to then be accessible. Last and not least, we want to send you with greetings on behalf of the 5 million Kenyans to your friend, His Excellency, the President of the Republic of Kenya. Please do send him our greetings. We believe that we also need a little bit of goodwill from him. We believe that if he puts in a good word, a lot of these things will move from my mouth to actually things that are being implemented on the ground. We believe that you have a direct line to him that we do not have, and you also have a soft spot. He has a soft spot for you, and we believe with your wonderful goodwill, we will be able to ensure that these patients get a dignity life. I thank you very much.
Thank you, Madam Caroline. On behalf of the Council of Governors, let me take this early opportunity to appreciate the effort of the Minister of Health, county governments, and other key stakeholders in the development of this policy. This is a step in the right direction. We are all gathered here today because of noble activity to launch the Kenya Palliative Care Policy. I say noble because providing palliative care to patients and families faced with various illnesses remains an essential part of any responsible health system. Palliative care is critical since it ensures that people lead high quality, pain-free, and dignified life even amidst sickness. As such, county governments shall continue to work closely with the national government and other stakeholders to ensure high-quality palliative care services in Kenya. Ladies and gentlemen, despite making rapid and significant progress in healthcare delivery since the onset of devolution, we still have a huge gap in the provision and access to palliative care across counties. Let's look at cancer, for instance, an area that we continue to make investments in both at the national as well as county levels. About 47,000 patients are diagnosed with cancer in Kenya annually. And of this, about 27,000 will die from this disease. We indeed have to sustain the fight against cancer and even invest more. The majority of those diagnosed with cancer, 7 out of 10, are diagnosed during the late stages of this disease and will need palliative care. Very few of these will, however, access this care. Only about 14,552 Kenyans with cancer access palliative care services annually. And this access becomes more limited among certain groups like children. Less than 5% of pediatric patients who need palliative care have access to it. This is a trend we all must change. Ladies and gentlemen, we know that sometimes palliative care comes alongside another process, the end of life issues, which are very hard to handle. It also comes with physical, psychological, and financial burden that often leaves families in poverty. The majority of the families never recover from these shocks. As such, we should continuously seek to improve access to quality palliative care services and break down various barriers like financing of palliative care services. It's on this note that I call upon the National Health Insurance Fund to look at this issue seriously. As I conclude, I would like to say the following. One is that cancer is a treatable condition, but early diagnosis is key. Timely diagnosis prevents advancement of the condition, while timely enrollment in palliative care lessens the burden to both individual and to the family. As county governments, we know that the already increased burden of cancers and other non-communicable diseases and continue to invest resources to curb these conditions. Our investments spread across prevention, treatment, and care. Today, most county governments are investing over 30% of their total budgets to health, despite having about 14 developed functions. That is the importance we accord to health. As a leader, I believe that this policy will provide direction on how to accelerate and streamline the provision of palliative care to patients with cancer and
amongst others represented here. Thank you for making time to be here today. Board members of the Nairobi Hospice, as well as the workers, the staff, the nurses who've been here before us and who've made it possible for us to be here, good afternoon. Your Excellency, I stand before you today representing my Cabinet Secretary, Mutahi Kagwe, who is involved in other official duties and could not join us today. Can't help but echo some of the words that he shares with us in the ministry. Mutahi Kagwe has told us that one of the reasons why we exist, in fact the sole reason why we exist in the Ministry of Health, is to put a smile in the face of the patient and the client. Your Excellency, he demeans the 5 years I spent in med school and says that they all end up with a smile on the patient's face. And he's correct. And perhaps that cannot be more true than this center that we're celebrating today, the Nairobi Hospice, whose key agenda is to put that smile in the face of the patient and the client. Mutahi Kagwe, who is involved in other official duties and could not join us today, can't help but echo some of the words that he shares with us in the ministry. Mutahi Kagwe has told us that one of the reasons why we exist, in fact the sole reason why we exist in the Ministry of Health, is to put a smile in the face of the patient and the client. Your Excellency, he demeans the 5 years I spent in med school and says that they all end up with a smile on the patient's face. And he's correct. And perhaps that cannot be more true than this center that we're celebrating today, the Nairobi Hospice, whose key agenda is to put that smile on palliative care patients and to ensure that the patient has the dignity that they require, that is their right, as they continue with their treatment. Your Excellency, today we are here to also celebrate and to commemorate the Palliative Care Week. This is a global commemoration. Different global communities are today celebrating this week as we try and ensure that we do shine a light towards the iniquities that exist when it comes to palliative care. Your Excellency, the Ministry of Health, together with partners present today, have done a lot of work, and let me, if you could allow me and indulge me, to celebrate the teams within the Ministry of Health, and many people have mentioned their names here. And Your Excellency, I can tell you these doctors, these officers are always knocking at our doors. Dr. Nyangasi, Dr. Maria, you need to stand and be seen by Her Excellency, because these are the people who've made this possible. Your Excellency, this policy is so crucial because the policy works on 4 key areas when it comes to palliative care. The first one is access to the service. And this has been mentioned and highlighted by everyone who has come before me. We need to move those numbers from 79 and ensure that those centers are available. The second issue that is highlighted in the policy is the issue of health financing. We need to talk about how do we finance palliative services? What is the role that NHIF will play? And Your Excellency, I must say, through the engagement of different partners on this podium, we've been able to review the benefit package, the UHC benefit package, to ensure that components of palliative care are included, and with increasing fiscal space to ensure that we can include more and more services in that benefit package. The third issue, Your Excellency, that is addressed in this policy is the issue of essential medicines and commodities. As we were touring the center, I did share with you that these patients require morphine, and sometimes the dosages of morphine required are very high. And this is a drug that is expensive. Engagements have happened within the Ministry of Health. We actually have the availability of morphine being there for our patients. And Your Excellency, in an institution not so far away from here, we have a small constitution unit, a small factory that actually constitutes the powder morphine into a soluble form so that the patients can receive it. We hope to grow this industry, and it's part of the local manufacturing agenda when it comes to morphine. The fourth area, the final area that is key in this policy, is the issue of infrastructure. Within the few coming months, we shall be able to launch cancer centers across the country. We have 9 of them that are upcoming in terms of launch and to ensure that they're operationalized, but also radiotherapy bunkers, which are very crucial when it comes to radio-oncology services. And so, Your Excellency, today, as you launch this policy, it is a milestone, it's a game changer when it comes to palliative care. As I come to conclude, Your Excellency, there is one area. I think Mr. General Macharia said he will not make requests of you, he will only make commitments. Today I'm going to do one better. I will make a commitment, but I also have one request. Our commitment as a Ministry of Health is to particularly pay attention to some of the vaccines that are so crucial in the fight against cancer. And here I'm talking about the Hpv vaccine. This vaccine is available in Kenya. Through the stewardship of His Excellency the President in past UNGA meetings, we've been able to secure dosages for our Kenyan girls. However, the uptake of this vaccine has not been so good. We stand at a mediocre 33% of coverage for Hpv vaccine in the country. As a ministry and with my technical team, we are committed to ensure we avail the resources, the vaccines, the technical expertise to ensure that our children get this vaccine. But my request to you is to be our drill sergeant and to hold us accountable, that we are able to meet that target, we are able to improve our coverage from 33%, and we're able to come back to you with reports that more of our girls have been vaccinated against HPV. So, Your Excellency, with that few remarks, I'd like to now invite you to the podium to address the crowd, and it's my distinct pleasure to welcome the First Lady of the Republic of Kenya, Mama Margaret Kenyatta. Karibu.
Thank you very much. Oh, kindly be seated. I shall pass on all your messages to my friend. Distinguished guests, ladies and gentlemen, thank you for inviting me to join you during the official opening of the Nairobi Hospice and the launch of the first national palliative care policy document. I was deeply honored by this invitation because it falls during the week of World Hospice and Palliative Day, when the entire world is united in action to recognize, acknowledge, and appreciate the vital role of palliative care. This year's theme, Leave No One Behind, Equity in Access to Palliative Care, resonates with the aspirations of universal health coverage. It calls for equity in access and affordable care as a basic human right. Palliative care is recognized as a human right because of the rising burden of non-communicable diseases that have caused life-limiting illnesses to millions of people globally. It requires creation of systems and adaptation of how we deliver health care. Its primary aim is to give patients dignity, relieve pain and suffering, and provide love and comfort as they go through difficult seasons in their lives. We have all experienced pain, the pain families endure when loved ones have been diagnosed with chronic or life-threatening illnesses. Cancer, HIV/AIDS, cardiovascular diseases, dementia, and kidney failure are some of the diseases that require this care. It's for this reason that I congratulate and applaud the joint efforts of all stakeholders, led by the Ministry of Health, for the development of the first national palliative care policy. The spirit of this policy builds on the National Palliative Care Guidelines, along with other resolutions and declarations Kenya has adopted, which acknowledge palliative care as key to the health ecosystem. The National Palliative Care Policy that we launched today will go a long way in shaping how Kenya delivers this care. The new standards, guidelines, and protocols will determine how this care is integrated and implemented. Adequate application of resources and research will build a wealth of evidence of palliative models which may be applied in our country and through specialized training enhance the quality of service. Palliative care has transformed the quality of life of patients. We are aware that early detection and treatment saves families from enduring high costs of hospitalization. It eases the pressure of our sometimes overwhelmed hospitals. We have come a long way in how we view this type of care. Taboos, cultural and social barriers that were in the past associated with life-threatening diseases have been replaced by a more progressive and caring attitude. Over and above medical care, it provides emotional and spiritual nourishment. However, more needs to be done to increase awareness amongst policymakers, health professionals, and the public about palliative care and its benefits. All this is possible if we improve our advocacy and education on this subject so that we apply it at all stages of disease management, from early diagnosis rather than end-of-life treatment. Research has also presented strong evidence in positioning palliative care as a critical component of primary health care. In Kenya, we have not reached the threshold for access to palliative care due to the rising burden of non-communicable diseases. It's even more discouraging to note that these services are severely limited among children. For this reason, I urge that we find solutions that will accelerate the integration of palliative care across all levels. I believe that this policy will go a long way in identifying solutions and paving way for increased allocation of resources to establish more palliative and hospice centers. It will also provide the necessary template for provision of affordable medicine and treatment for managing symptoms. These solutions also require the recognition of community health workers for the crucial role that they play in the provision of care within the communities. I urge this cadre of health caregivers are incorporated into palliative care training in order to build their skills in supporting patients and families in home settings. So as we celebrate World Palliative and Hospice Week, we acknowledge the remarkable growth of palliative care services in Kenya. Hospices and palliative care institutions like the Nairobi Hospice, who we celebrate today, have provided over 30 years of service. I applaud the entire Nairobi Hospice team for the new facility we have opened today. You have been a beacon of hope to so many since you opened your door. We celebrate your impact, your commitment, your devotion. With those remarks, I declare the new Nairobi Hospice officially opened and the National Palliative Care Policy officially launched. Asante sana. God bless you all.
Thank you, Your Excellency. Tumpigie makofi tena Mheshimiwa Mama wa Taifa. Thank you. At this moment, Your Excellency, I now welcome you to where we are going to conduct the launch, accompanied by the Chair, Madam CS, the Governor. Thank you. At this moment, Your Excellency, I now welcome you to where we are going to conduct the launch, accompanied by the Chair, Madam CS, the Governor. On behalf of the partners, tupige makofi. Asante sana our partner. Daktari, thank you. And thanks for your patience, Daktari. And now we are going to have a photo. I will request that, yes, Your Excellency, we are going back. We are going to do the photos on the other side. May I beg your pardon, because of the sun, we are moving on this side. Thank you. That shadow will not give us what we want. It will be a standing photo. I will begin by the front line, which sat by Your Excellency. Kindly, Governor, Chair, yes, with your policy books first. We want to show to the world. The ones with the books, please. All the ones who received the copy of the policy. Can we have that photo with our love policy?